Ms. Capps, you seek recognition for an amendment?
Yes, Mr. Chairman, I have an amendment at the desk.
Clerk will report the amendment.
It's titled Waxman 1. But it's not Waxman who's...
I wonder where the chairman is on this amendment.
Is that the one I changed my mind about?
We'll find out.
Amendment
Yes.
offered by Mrs. Capps of California.
Without objection, the amendment will be considered as read. And gentlelady from California is recognized.
Reserve a point of order, Mr. Chairman.
Mr. Scalise reserved a point of order.
As members are receiving copies of the amendment, perhaps I could begin to discuss it. This amendment would establish a grant program through the Centers for Disease Control, CDC, to support or conduct evidence-based education programs to reduce teen pregnancy or sexually transmitted diseases and to promote healthy adolescent development. Health education and prevention are at the core of setting young people on a course for a healthy life. During my many years as a school nurse in a local school district in California, I learned this firsthand. But we are failing when 1 in 3 girls in the United States gets pregnant at least once before the age of 20. And just this past Friday, the CDC released a report showing troubling trends in adolescents' health. The teen birth rate, which had been declining since 1991, began to increase again between 2005 and 2007. And we are failing if half of all new sexually transmitted infections occur among young people aged 15 to 24. Again, the same study from the CDC includes information about the rate of AIDS diagnosis among young men aged 15 and 19, and that it has doubled over the past 10 years. One thing we can do to reverse this trend is to invest in evidence-based programs aimed at teen pregnancy prevention, and that's what this amendment would do. The Healthy Teen Initiative, as it's called, would give money to states to implement or support education programs that have been demonstrated to delay initiation of sex and reduce teen pregnancy, sexually transmitted diseases, and risk behaviors that lead to them. States would be allowed to award grants or contracts to public or private nonprofit entities, including programs or community schools or community organizations, to conduct these programs. It would require independent evaluation of the programs and require that they demonstrate that they be medically accurate and age appropriate. This initiative makes it clear that it would not in any way preempt state laws regarding parents' involvement and decision-making in their children's education. If a program, now any program, comprehensive, abstinence-only, or any program, is medically accurate, age-appropriate, and evidence-based, it will be eligible for funding. I want to stress that the amendment does not make any requirements about the content of the program, but rather a series of criteria that any program must meet. This program will be an important addition to overall prevention and wellness efforts that are being initiated through the underlying legislation. So I urge my colleagues to join me in supporting this amendment. And now with some remaining time, well, I'm happy to either yield back my time or yield it to anyone else who wishes to speak on the topic. I'll yield it back. Or could I
ask a question?
Duback. Certainly.
Would your program then eliminate the abstinence-only program?
No, in fact, it could include it. Any program is eligible for the funds if they meet the criteria.
But it eliminates Title V, right? Because that's where a lot of the abstinence-only money is found.
No, it doesn't eliminate anything. It's a grant program.
If you don't reauthorize it, then it's basically dead then, right? I mean, Title V is only, it expires, I believe it's this year. So, and you don't reauthorize it, so therefore you basically do away with the abstinence-only funding.
This doesn't deal with Title V. It's an amendment aimed at prevention and authorizing the CDC.
Well, okay. So you're saying you're silent on Title V?
It's a totally separate program. I am silent. This amendment is silent on Title V.
Okay.
Would the gentlelady yield?
I will
Generally,
yield to,
At the end, at the beginning of your amendment, it says at the end of Title V, a Division C is added the following. Mr. Stupak asked a question, and you said it has nothing to do with Title V. Mr. Stupak was asking
Title
specifically-
V of this bill, not the Title V that I believe
all right.
Mr. Stupak was
right, thanks.
referring to.
The gentlelady, I ask you, you yield to me.
Of course.
Thank you. I appreciate. Now, there's already under sex education, which I forget which Title III of not this bill, but TANF, I think. But that is extraordinarily similar to this. So my question is, isn't this duplicative of already existing sex education programs?
To my knowledge, there is no program that is set up for evidence-based criteria.
All right. So the sex education, whether it's an abstinence-based or the others, are not evidence-based,
No,
even though that's been the argument against the abstinence.
they have to
by
meet the criteria to apply for these grants.
And this is the criteria set by the CDC.
Right.
And this is an additional $50 billion. I mean, million.
Million.
50 million for 4 years. But it seems to be, even though it's based through the CDC, it basically is going to be the same type of education that's already in the sex education funding programs.
No, those are not evidence-based, at least not specifically according to the criteria.
What do you think it would take under your bill to become evidence-based?
It's not for me to decide.
It's for the CDC.
Exactly.
Don't you think that all of the sex education are using evidence within their program?
Pardon?
Do
There
you-
is no evidence to that fact.
that they're using evidence. Okay.
Gentlelady's
My
time has
time is up.
expired. Mr. Murphy.
Thank you, Mr. Chairman. With the gentlelady from California, yield for some colloquy on this. We had just addressed Ms. Sutton's amendment, which included in here for these community educators to include working on risk behavior factors, including risky sexual behavior. This seems to overlap with that. How is it? Is it duplicative? Are they entirely? Are we going to have two teams of people out there working on this in the community?
This is an educationally based program that is that a state would apply for funds for.
Understand. Where would these educational sessions take place?
Usually through a school setting.
Should we define that in the bill that it's at a school
No,
setting?
because it could be. It's left to the discretion.
And I'm back here. I go back to the
Of
one
the
that
state.
Ms. Sutton had too. Do we know where those sessions are supposed to take place? Those education sessions with people involved with risky
Is
sexual
this
behavior?
a question for me?
Yes, because I'm trying to balance these two, that we're not just duplicating with more
I think
millions.
there, one is an out, to my knowledge, I'm not an expert on Ms. Sutton's bill or Ms. Christensen's bill, those are outreach programs. This is an education-based program.
Well, the other thing, I'm hoping this has to do with education, because it's educate, guide, and provide experiential learning opportunities. Although I don't know what experiential learning opportunities have to do with sexual behavior and Sutton's, but I'm concerned here too that neither one, unless I'm mistaking something, do you define the qualification of the persons who are going to go out there and teach kids about sexual behaviors?
No, I define this as something that we've already experienced through health education classes in school settings, and those are sometimes taught by credentialed school teachers or nurses, but they are sometimes designed by the state to bring in physicians from reputable clinics and other people who can provide this education.
Would you be willing to work on something here that either now or later that adds some strength to this? I would think a lot of parents would be concerned that people out there without any defined professional qualifications would be able to do these classes. I like your idea of saying these have to be some with nurses or some medical certification
I
or
didn't say
something.
they had to be. This is for states to decide, and it already specifically says that states that allow parents to be involved in the decision-making, either in the particular curriculum that their school district uses or in whether or not their child shall participate.
I understand that. What I'm deeply concerned about is who is teaching the children about sex. And if you're going to provide this grant to the states, I'd be very concerned it doesn't come with some strings attached saying it just can't be any person who wants to teach sex education. It ought to be someone with some professional qualifications.
It isn't up to the CDC to determine who is the teacher. Those are state contracts or community contracts.
Right.
It is up to this program is designed to make sure that criteria in whatever curriculum is used. It's curriculum that is being evaluated in terms of its criteria by the CDC.
Well, another thing here, I'm assuming you talk about evidence-based medicine, and I'm assuming that evidence means that this program should also be subject to evidence-based medicine, but I don't see requirements in here that there should be some proof of outcome that it actually reduced initiation of
Yes.
sex, decreased the number of partners, reduced teen pregnancy.
That is actually a requirement. That's part of the evidence.
But I mean, so does it say, unless I'm missing it here, but I just got the amendment, does it say somewhere in here that if an organization or a state failed to reduce those issues, that they would not get their grant money?
I would believe that would be lack of evidence.
I just don't see it in here. That it doesn't necessarily
on
say in here that if they
page
fail
line
to reduce,
20.
is it in here somewhere that I missed?
Page 2, line 20, describe how the state's proposal will address the needs of at-risk teens in the state.
I understand,
And
but
then identify
addressing
the
and actually
evidence
coming up with evidence,
Will the gentleman
Gentlemen
yield?
yield.
I'm just trying to find that, yes.
Will the gentleman yield? Page 3, line 11, E, evaluation through line 20. That's where it addresses those concerns.
Well, it says that they have an independent evaluation. It says they have to submit a report. It doesn't say that if they fail to do that, they're not eligible for more funds.
Well, they are not eligible.
Could
They
we-
have to produce the independent evaluation. They have to be evaluated. The CDC is in charge of the evaluation.
In my remaining time, would the gentlelady be amenable to perhaps putting some wording in this that specifically says that if they're not able to produce results,
I
they
believe
don't
it's clear in
continue?
the amendment, sir.
It's not in here. I'm
Page
still
4,
looking for it.
line 3.
Page 4 now? See, people told me it's page 2 and page 3. Now it's page 4?
The whole amendment deals with what you're talking about.
There's nothing in here that specifically says if they fail to meet the goals of this under the definition, that they're no longer eligible for funding.
Well, I believe it does, sir.
Well, I understand your belief, and I
Well,
highly respect
it's
your
a several
profession. I'm
different
just
way.
trying to find where it specifically says that, because we're spending $50 million, and the taxpayers ought to know that if we're spending that, we're demanding some outcome-based medicine here.
First of all,
Please.
the curriculum is submitted
Yeah?
for evaluation and documentation that the criteria are met.
Mm-hmm.
These are evaluated by the Centers for Disease Control, and the CDC then publishes a list of those that have been evaluated to meet the criteria of those curricula that have been approved. The states may choose, or the individual school districts may choose.
I understand all that. I still go back to this point. I know I'm out of time here, but that if they don't produce results to reduce the very things you state,
They don't meet the criteria.
then they would not be eligible for further funds. I would
Exactly.
still think that would strengthen it and make it more amenable to taxpayers. And that I yield back. I'm sorry, Mr. Chairman.
Mr. Chairman?
Yes, gentlemen,
Mr. Chairman?
who seeks recognition? Mr. Stupak.
Thank you, Mr. Chairman. Mr. Chairman, in reviewing this amendment, I reluctantly going to have to oppose this amendment. If I go back and if I remember when we did the 2010 budget, the president's budget, he really took all the money out of abstinence-only education. And the proposal that the president said he's going to redirect all funding to a new teen pregnancy prevention initiative that uses comprehensive sex education curriculum. My problem is comprehensive sex education curriculum receives right now underneath the budget about 12 times more money than abstinence-only does. Yes. And abstinence-only education uses the A through H model, which the Catholic schools use. And I think you would then, if the president fulfills his promise, you'd get rid of that money for abstinence only, and the Catholic schools would be left out. The A through H program would be gone. We only spend 1/12 of the money we do for comprehensive sex education. So I think this program would really be targeted towards abstinence only. It would get rid of it, the little bit of money we do spend for it. And if we go back and if we look at the first amendment we passed here in this committee on this markup last Friday, the Sullivan Amendment, does this then become a duplicative program, which we said the Secretary would then have to close out? So I can see a number of problems here with this amendment, so I'm going to oppose it. And
Would the gentleman yield?
Sure.
Thank you to my friend from Michigan. This is a separate grant program from whatever you're describing that the President has or has not authorized. To my experience, there are many abstinence-only programs being used in communities that I have represented and places that I have visited. I've seen them. There are now going to be criteria. If states wish to apply for the funds for the implementation of programs abstinence-based only, any program is qualified to apply if it meets the criteria that are set out by the Centers for Disease Control, then it can be eligible for the grant funding. I don't think it replaces anything that you might be talking about.
Well, reclaim my time. I know we haven't done labor HHS bill right now, but it's my understanding there is no abstinence-only money in the labor HHS bill, which we're going to take up later this month. So how is your bill really anything different than the 2010 budget proposal that we did, in which the President's budget did away with abstinence only and put it in this comprehensive sex education program, which now receives, as I said, $12 to every $1 abstinence only. You may not agree with abstinence only.
I'm not taking
and I'm not debating those merits, but it's another tool we use. So why would you put forth an amendment that gets rid of the little bit of money we spend on abstinence only to start another program
This
with
does
new
not
criteria?
replace any funding.
And I really don't see how the new criteria is any different than that of what the President called for in the 2010 budget proposal he did, or in the proposed language that I've seen for labor HHS. So that's my reluctance to support this amendment, and I'd hope in this area we would leave as is. You know, there are over 500 abstinence programs we're using now in the United States,
Yes.
and that's why the Sullivan Amendment that we voted for the other day made some sense. If we have duplications in these areas, maybe we should get rid of them. And now we're adding another program, so I guess we could see if we pass your amendment, we now have 501 different.
Excuse me, this is not a program. This is establishing a grant.
Well, once they give you the
grant.
money, reclaiming my
Opportunity.
time, it becomes a program. I mean, you don't give grants for the heck of it.
But this is not a curriculum. This is to deal with prevention. When we see the numbers rise of teens getting pregnant.
Right. Reclaiming my time. You're right. The last 2 years, teen pregnancies are up. We only had abstinence only since 1996. The first 12 years, teen pregnancy went down. The last 2 years, they've gone up. So you can argue either way, but I would tend to argue abstinence only in some settings, especially in Catholic schools and other religious schools where they use the money not just for abstinence only, but also health education. It's a valuable program. We have limited dollars, and I just don't want to see a whole other program put in here to take more money away from that small program called abstinence only, which is underfunded 12-1 to comprehensive sex education programs.
Mr. Chairman?
Gentlemen, yield to
back.
me.
Sure, Mr. Chairman.
Well, it seems to me that a lot of these abstinence-only programs were not successful because they were more ideological than trying to give honest information to teenagers. And I think that there's nothing wrong with an abstinence-only program, but they ought to be honest about how they are delivering their message. This program that's being proposed is grants to the states to go to schools or other places for educational purposes on how to reduce teen sexuality, and they want to make sure that it's tested to be based on evidence. A lot of those abstinence-only programs not only gave misinformation, but they didn't succeed in accomplishing their goals.
Yeah.
Now,
Well,
if it's an abstinence-only program that succeeds and is directed at the science and the morality, it should be judged on whether it accomplishes the goal of reducing teenage pregnancy and sexually transmitted diseases. And if it doesn't, because some of them did not, when, well, I didn't realize the time has passed.
Move to strike the
Well,
line.
can I just respond?
Without objection, you'll be given an additional
Sure.
minute.
For the record, if you like, I'll give you 9 different studies. The latest 2005 by Centers for Disease Control conclusion, fewer teens are having sex, which means more teens are choosing abstinence. Actually, you go back to the Journal of Adolescent Health, 2004, abstinence has substantially contributed to the decrease in teen pregnancy. You can go to the American Journal of Health Behavior, abstinence education reduces sexual initiation over a 12-month period. Go to the Journal of Health Communications. It says abstinence education demonstrates statistically significant, consistent changes on measures of program awareness, beliefs, attitudes, self-reported behaviors, and pregnancy rates.
Gentlemen, yield. If you're right, then, as I understand it, they'd be eligible for grants under this program. But I want to be sure that they're living up to
My concern is
they succeed.
Yeah, my concern is the President's budget proposal and the labor HHS appropriations we're about due this week does away with the money for abstinence only. And these aren't reports I wrote, these are other reports. And now we're adding another
would
program, so it's easier to fund a program authorized as opposed to one that the President may not agree with. So therefore, I would reluctantly
Move to strike the last.
I move to strike the
vote
last
against
word.
the
Instead of
amendment.
seeking recognition. Mr. Boyer.
Thank you, Mr. Chairman. I want to compliment you for bringing the amendment. I am pro-life. Whenever I see amendments like this, immediately I get concerned about how much money may be directed to Planned Parenthood. I'm just being honest, I do. I am also pragmatic. So while I'm an individual who is pro-life and pragmatic, that means in the past I have voted that teenagers could gain access to condoms, for example, without parental notification. I have voted for that. Now, why do I talk about this in this debate? We have a pandemic facing our country. Over 70 million Americans have had a sexually transmitted disease. 70 million Americans. Now, think about that. So let's stop trying to kid ourselves here. I believe parents should be giving that education to their children. Are parents doing their job? Are they acting responsibly? The answer is they must not be. There's a real problem out there. Now, go to this issue that the chairman brought up about moralistic approach versus ideological approach. Mr. Chairman, that is exactly what I brought up when we did the tobacco legislation. I said you're doing abstinence, we're not being pragmatic without a harm reduction strategy. And that's exactly now what we're talking about here. Mr. Stupak is arguing for abstinence, and Ms. Capps, you're arguing for education, and education on about a harm reduction strategy that can help better our society. So the reality is we both have to come together. Those of whom promote abstinence also must embrace risk management, about healthy choices, harm reduction strategies. It's coupled through education. But Ms. Capps, you should be a very good listener here to Dr. Murphy, who has genuine concerns, though, about who should be teaching that. Should they be licensed? What are the qualifications for that? So please just don't say, well, we'll just leave that up to the states. I think what I would ask you, Ms. Capps, is to work with Dr. Murphy here. Work with myself. I don't object to what you're doing here, because we better face this fact about 70 million Americans having sexually transmitted diseases. And see, Mr. Chairman, when I get you to have buy-in to couple abstinence with a harm reduction strategy and education with regard to how we approach this type of behavior, I will win your support on a harm reduction strategy with tobacco when I bring that legislation. Because we can't be one way on one thing and some way and take a different approach. And you and I have had that discussion. You're the one that used the word pragmatic to me when you said, Steve, we do have to do both. We have to couple them. So I just want to share, everyone, that's where I am in this question. So I like this amendment, but I think it needs a little more perfecting, Ms. Capps, and I'm hopeful that you're going to be a good listener. I want to yield to Dr. Murphy, because he has some concerns here, and then Dr. Murphy, share a little bit of time to give to Ranking Member.
Thank you. Thank you, gentlemen. I just want to add a little bit more to what I was saying before about I'm concerned about defining who would be doing this. When someone is licensed or certified, whether they're a teacher or a nurse, whoever, at least there's some professional status that they have. They have professional ethics. They have continuing education requirements. And in this, and I've read this again, I still don't see anything here that specifically says if someone fails to achieve these results, they're not eligible for further grants. I'm very concerned that we all share a passion for reducing these problems. They are serious problems in our society. And I have dealt with more than my share of children born to single parents or have serious problems or a whole host of things. But I want to make sure that we are using the very criterion we're demanding here, and that's evidence-based medicine, and saying if the evidence isn't there, state, from what you do, then your organizations under this aren't going to get some money. Let's make them, let's define that they have to think in those terms of some evidence and put people there. We've seen enough problems with people in every profession out there who get involved in these things, maybe give misinformation. So I hope we will still consider that as some professional criteria and some requirements of results. And I yield to the chairman.
Time and yield to the ranking member.
I think I have the perfect antidote, Mr. Chairman, to teenage pregnancy. Require every teenager to sit through one of these markups. If that doesn't put you in a non-sexual, non-interactive mood, nothing will. But I didn't think it was that funny, but
I'll yield back my time.
anyway, I
Chairman.
do. I have my substantive point, Mr. Chairman. No, the gentlelady from California.
Without objection, gentlemen, be given an additional minute.
The gentlelady has already passed one amendment to the pending bill that adds over $500 million in spending over 5 years, at least authorization level. If we pass this one too, this one is $50 million a year for 5 years, which is another $250 million. That's $750 million with no offset, no cost saving requirement, and I think that's a little bit much. I would oppose it on the physically sound policy, not just some of the substantive issues that have been raised. And with that, I thank the chair for yielding additional time.
Mr. Chairman,
Mr. Gatt,
I move to strike the last word.
gentlelady is recognized.
I just want to clear up a couple of things that have been said. First of all, we've had abstinence-only sex education around since 1981, when Congress first passed the Adolescent Family Life Act. And then, as Mr. Stupak said, in 1996, we approved Title V, and that also is a block grant program that continues to this day. But I found it fascinating that some of my friends on the other side were very, very concerned about what kind of evaluation techniques Ms. Capps was going to use in her amendment, because, in fact, virtually every study shows that abstinence only does not work. And I have a great deal of love and affection for my friend Mr. Stupak, but those studies he's talking about, I don't think they're abstinence only. Congress, because of this ongoing debate that we've had for so many years, Congress actually asked for a study, and we commissioned this study from Mathematica, Inc. The study came out in April 2007, and what they found was that teenagers who participated in abstinence-only sex education programs had just as many sexual partners as teenagers who had not participated in the program, and that abstinence-only kids were no more likely to abstain from sex than other kids. Now, there was a Texas A&M study, and I'm kind of loath to say that sitting next to my buddy, Mr. Green.
I'm not the Aggie, our ranking member is the Aggie.
Okay, our Mr. Ranking Member, this Texas A&M evaluation of 5 abstinence-only programs being taught in Texas schools reported that students in virtually all high schools were more sexually active after taking the course. And I will also note that under Title V, let me just finish. Under Title V, the criteria that they set forward, if you look at Section 510 of Title V, the criteria are admirable goals, most of them, and ones that I would want to teach my children, but they're not science-based. And that's why abstinence-only sex education, when taught as part of a high school curriculum or school curriculum, is not very effective. So this is why I've been a big proponent, many of us have been proponents for years, of abstinence-based or science-based sex education, because it will work. And that's why Ms. Capps is saying that abstinence only could be allowed under her amendment if it was proven to be scientifically effective. But I will also note, and I've looked at a lot of the curriculums of these abstinence-only programs, some of them are based in religion, which is fine if you're teaching that in a religious school, but they're not appropriate with federal funds. Some of them are sort of based in folklore and fairy tales, and we really, if we're really going to teach our kids to refrain from sex, and believe you me, I have 2 teenage daughters. I teach abstinence over at my house every day, but we have to do it in a science-based way. And with that, I'll yield the remainder of my time to Ms. Capps.
And I won't take the entire time. I just want to go back to what this amendment does. It is limited in scope, with all due respect to who's teaching it, the class, or the content of the class. That is not the subject. But to this point, we have never established a grant program, and I did use the word program, that's based on evidence, that where the criteria is, does it work? That is all the CDC seeks to establish, and it is up to the states to apply for the funding and then to implement it with the kind of content and the kind of quality of the teachers that they wish to impose upon it. And with that,
I'll yield briefly to the gentleman from Texas.
Thank you, Mr. Chairman. I just want to respond to our ranking member, my good friend. The authorization levels that are in this amendment and the earlier CAPS amendment are really authorization levels. So, we don't know what the Appropriations Committee may fund. But in 2007, there was only $176 million. Well, I take that back. Funding abstinence-only programs at the astonishing level of $60 million. So I don't even know if our Appropriations Committee would increase it that much. But I agree with the amendment that we need to have evidence-based, no matter whether it's abstinence or any other program. It should be evidence-based. And I thank my colleague for yielding.
I'll yield to the chairman.
I am going to support your amendment, but I think Mr. Murphy raises some good points, and I'd like to request that Ms. Capps, should her amendment be adopted, continue to talk to Mr. Murphy and others to pin down some of those issues that he has raised, to be sure that we have competent people administering the programs, and perhaps even to talk to Mr. Boyer about making sure that this is a pragmatic approach. We want to stop this epidemic of teenage sex and unplanned pregnancies and sexually transmitted diseases.
Mr. Chairman, I ask unanimous consent Ms. Capps be granted an additional minute.
Without objection. It's not her time, though.
Mr. Chairman, I asked to speak.
Oh, I'm sorry. To get an additional minute. I ask
Without,
unanimous consent from
without
Ms.
objection.
to grant an additional minute.
Without
the gentlelady yield.
I'll yield.
Thank you. I'd like to ask you a question, Ms. Capps.
yes.
How do we do scientific? How do we do in abstinence education? You will permit it if it's scientifically based. How do we?
I didn't say scientifically based, I said evidence-based.
Okay. How do
Does
we
it work?
How do we do evidence-based for abstinence? How do we do that?
The Center for Disease Control can do that.
Reclaiming my time, there are whole curriculums, and Mr. Boyer, I'd be happy to get you that information, how
All right,
they do that.
I'll be more than happy
Because there are
to.
whole curriculums.
I just want to, Ms. Capps, if we can achieve exactly what the chairman's doing here, if we can couple and move toward pragmatism where we can actually do abstinence with your goals to attack the pandemic that we have, I'll embrace your amendment. I will.
But it's not limited
But
to
please-
abstinence.
And reclaiming my time,
I-
that's why we say abstinence can be part of this. And I'll yield back.
And I'm happy to work with anyone in terms of implementation of this amendment
Mr.
after
Barton.
it's passed.
Mr. Chairman,
Should it pass?
I want to speak, strike the requisite number of words.
Gentleman's recognized.
Ms. Congresswoman DeGette made an incorrect statement in her time when she said that abstinence education had been around since the 1980s. Every girl I dated in high school practiced it. And it was very effective because when I went to pick them up, their father reinforced it on me. So it does work. It does work, and it has been around much longer than the 1980s.
Maybe on a case-by-case basis, Mr. Burton.
That I yield back.
What does the gentleman yield?
Yield to my friend from Louisiana.
I want to thank the ranking member. And getting back to the authorization, this is a $250 million authorization. And while the title talks about preventing teen pregnancy, if you actually read the language on page 2, lines 3 and 4, the two goals are to reduce teen pregnancy or sexually transmitted diseases, not and sexually transmitted diseases, or. And then when you go to the actual evidence-based definition, we've been hearing all this about evidence-based as if we're talking about proof that you're reducing teen pregnancy. The term evidence-based definition, the definition means based on a model that has been found in methodologically sound research. You go to number 5, to improve rates of contraceptive use. So the bar is set so low on this, we're talking $250 million of taxpayer money that's being authorized as all this conversation about lowering the cost curve, bending the cost curve down. This bends the cost curve up $250 million more dollars, and it allows a group like Planned Parenthood in a state that doesn't have a prohibition without a child's consent. It would allow a group like Planned Parenthood to just get this money and go in and prove that they improved rates of contraceptive use. Teen pregnancy could actually go up.
Would the gentleman yield?
Let me finish the thought. Teen pregnancy could actually increase, and according to the language on page 2, as long as they controlled sexually transmitted diseases, they could get the money as long as they proved that young teenage girls had an improved rate of contraceptive use. And they could qualify and meet all the goals for this money, $50 million a year. I think this is
Mr. Scalise, would you yield?
I'd be happy to.
Mr. Scalise?
The ranking member's got the time, so I'll yield back to him. And if he wants to yield,
Gentleman yield.
I would yield to the ranking member.
Mr. Booyer.
The challenge that we have is that not all sexually transmitted diseases can be prevented with condoms. So you've got some sexually transmitted diseases that are best controlled through abstinence. And we're back to now the chairman's, I'll embrace the chairman's word about pragmatism. You have to do both. And I'll throw it right back to you, Ms. Capps. I want you to please work with Dr. Murphy and myself or any other member that may have
Happy to do it.
concerns, and maybe we can work this out in a manner that you get comfort with Mr. Stupak and myself that we actually can couple the two to attack the pandemic. With that, I'll yield back to the gentleman.
And I yield back, Mr. Chairman.
Are we ready for the question? Mr. Cherry.
Move to strike the last word.
Gentleman's recognized.
Thank you. Question for counsel, if you can help me out. The current sex education programs are not evidence-based. What are those programs?
To my knowledge, sir, there are 2 programs on abstinence only, one contained within...
No, I said sex education, not abstinence only.
To my knowledge, there are no purely sex education programs within the jurisdiction of the Energy and Commerce.
That wasn't my question, but I think that was your answer.
If there are programs authorized in the Education and Labor Committee or the Ways and Means Committee, I'm sorry, I don't know.
So the Adolescence and Family Act, Title 20 is not part of this, or the abstinence is not part of the
Adolescent
program?
Family Life Program, which is Title 20 of the Public Health Service Act, is an abstinence-only program.
Okay. So the sex education ones don't have any jurisdiction here. It's just when you don't have sex, this committee has jurisdiction.
As part of a number of other programs, one component of the provision of health care services may be sex education. It is included in the sex education may be included, for instance, the maternal and child health program. It may be included in the Title X family planning program. It may be included in the Ryan White Healthcare Services program. There are a number of programs in which sex education is discussed. But as a primary purpose for a grant program, there are no programs in this that I know of in this committee's jurisdiction that are not abstinence-only sex education programs.
Okay.
Are we ready for the vote? All those in favor of the Capps amendment will say aye. Aye. Opposed, no. The ayes have it. The amendment's agreed to.
Mr. Chairman, I'd like a roll call vote.
Clerk will call the roll.
Mr. Waxman.
Aye.
Mr. Waxman votes aye. Mr. Dingle. Mr. Dingle votes aye. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone, aye. Mr. Gordon. Mr. Rush. Ms. Eshoo. Ms. Eshoo votes aye. Mr. Stupak. Mr. Stupak, no. Mr. Engel. Mr. Engel, aye. Mr. Green. Mr. Green, aye. Ms. DeGette. Ms. DeGette votes aye. Mrs. Capps. Mrs. Capps, aye. Mr. Doyle. Mr. Doyle, aye. Ms. Harmon. Ms. Harmon votes aye. Ms. Schakowsky. Ms. Schakowsky, aye. Mr. Gonzalez. Mr. Gonzalez, aye. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, aye. Mr. Mellison. Mr. Mellison, no. Mr. Barrow. Mr. Barrow votes aye. Mr. Hill. Mr. Hill votes aye. Ms. Matsui. Ms. Matsui, aye. Mrs. Christensen. Mrs. Christensen, aye. Ms. Castor. Ms. Castor, aye. Mr. Sarbanes. Mr. Sarbanes, aye. Mr. Murphy of Connecticut. Mr. Murphy, aye. Mr. Space. Mr. Space, aye. Mr. McNerney. Mr. McNerney, aye. Ms. Sutton. Ms. Sutton votes aye. Mr. Braley. Mr. Welch. Mr. Barton. Mr. Barton, no. Mr. Hall. Mr. Hall votes aye. Mr. Upton. Mr. Stearns. Mr. Stearns, no. Mr. Deal. Mr. Deal votes no. Mr. Whitfield. Mr. Whitfield, no. Mr. Shimkus. Mr. Shimkus, no. Mr. Shattuck. Mr. Shattuck, no. Mr. Blunt. Mr. Blunt, no. Mr. Boyer. Mr. Boyer, aye. Mr. Radonovich. Mr. Radonovich, no. Mr. Pitts. Mr. Pitts votes no. Ms. Bono Mack. Ms. Bono Mack, no. Mr. Walden. Mr. Walden, no. Mr. Terry. Mr. Terry votes no. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mrs. Myrick, no. Mr. Sullivan. Mr. Sullivan, no. Mr. Murphy of Pennsylvania. Mr. Murphy, no. Mr. Burgess. Mr. Burgess, no. Ms. Blackburn. Ms. Blackburn, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no.
Other members wish to be recorded?
Mr. Braley is not votes. I'm sorry. Mr. Braley votes aye. Yeah.
Mr. Markey?
Mr. Boucher.
No, you'll call him.
Mr. Boucher. Mr. Boucher votes aye. Mr. Markey. Mr. Markey, aye. Mr. Matheson. Mr. Matheson, aye. Mr. Ross. Mr. Ross, no. Mr. Welch? Mr. Welch votes aye.
Have all members responded to the call of the roll? Clerk will tally the vote. Clerk will announce the vote.
Mr. Chairman, on that vote, there were 33 ayes and 23 noes.
33 ayes, 23 noes. The ayes have it, and the amendment's agreed to.